I wholeheartedly believe that in many cases it can be prevented. There, of course, are some really serious genetic mutations. For the majority of people that have a genetic vulnerability, like the ApoE4 allele, one or two copies of that, there is other people that don't have genetic vulnerability but have other risk factors. I think it is absolutely possible to prevent and delay onset of Alzheimer's or neurodegeneration through our lifestyle and through understanding what your risk factors are and addressing those in a comprehensive fashion.
Welcome to Power Up Recovery with Nutrition. It is time to make nutrition part of the conversation. I'm your host, Christina Veselak, and I'm so glad you're here. Did you know that it's our brain's job to allow us to cope with stress gracefully? But to do that, it needs to be fed optimally. Have you ever wondered why so many committed people relapse or maybe even die? Why so many people on psychotropic medication still feel lousy and still have cravings? What if the missing piece is food, the right food? What if the right nutrients like amino acids or even eating protein every 4 hours could actually balance your brain chemistry and your mood without medication and support lasting recovery? In this podcast, we explore the powerful connection between feeding your brain well, mental health, relapse, and recovery from addiction. We will share insights from experts, inspiring recovery stories, and practical strategies you can use today. Whether you're in recovery, a healthcare professional, or someone passionate about emotional well being, this show is for you. Let's dive in and discover how fueling your body and brain with the right food, the right amino acids, and other key nutrients can fuel your transformation today. Welcome. Hi, everyone. Welcome to the next episode of Power Up Recovery with Nutrition, where we look at the science and the practice of integrating nutrition into mental health and addiction recovery. So I get to interview wonderful people, from those who have used these methods to improve their own mental health and recovery and often completely turn it around so they can be thriving, high-level scientists and practitioners. So today I am delighted to interview Dr. Cynthia Libert, who I am just getting to know. Dr. Libert integrates evidence-based nutrition, lifestyle medicine, functional psychiatry, and compassion whole person care to help patients restore metabolic, emotional, and neurological resilience. I love that. Advanced training in functional and integrative psychiatry. She is passionate about the connection between nutrition, mental health, recovery, and long-term brain vitality. Through her clinical work, teaching, and media platforms, Dr. Libert empowers individuals to understand their biology, nourish their brains, and step into the fullness of life.
Super.
Thank you so much for being with us. Welcome.
Thank you so much for having me, Christina. It's a privilege.
Now, Cindy, your practice is in one of the Carolinas?
Yeah, I'm in Western North Carolina in Asheville, up in the
In
mountains
Asheville.
here. Hmm.
Okay, so I'm just kind of over the mountains from you in West Virginia.
Nice. Excellent. I have a few patients from West Virginia.
Do you? Okay.
Mhm.
Okay, yeah. So we're both sort of in the middle of Appalachia,
Yeah,
which has its own unique needs,
indeed.
which is interesting. So, you took Dr. Greenblatt's fellowship program to really learn how to integrate nutrition into what you do for mental health. Can you tell us a little bit about what got you interested in that, and what you learned and how you apply it on a daily basis?
Yeah, well, thank you for that question. It's been quite a journey. That's one of my latest forays into, getting equipped to better help people with their brains through uh, nutrition, through lifestyle medicine. I have my own burnout experience and challenges with mental health, just with the stress of the occupational training, in medical
Yeah.
school and residency, and starting to have babies. My last year in family medicine residency, I had
Oh
a
dear.
baby, and then two more after that in private practice, and it kind of set me up for a burnout experience and my own health challenges with anxiety and low mood and a myriad of other things, migraines and blood pressure
Hmm.
spikes. And so, like most functional medicine doctors, it's a personal journey, a humbling process of saying, what I was taught is not working for me here. And so that began a journey. Well, really, I always had an interest in integrative, and well, I didn't know the term functional until well into
Uh-huh.
my practice, but in medical school, I took some courses in integrative medicine, and so I've
Oh,
always
nice.
had this interest. But back in like 2009, I was in private practice. I got a chance to integrate a lifestyle medicine program where we taught people how to eat the Mediterranean diet and put
Right.
them on fish oil and vitamin D, and it was life changing for a lot of my patients that did engage with that. Unfortunately, it was in the conventional medicine model, the insurance payer system, and that made me a whole lot less profitable than my partners in private practice. So that led to some challenges. And, I've had to evolve my practice model over time. And, once you start going down the path of seeing the power of nutrition and targeted nutritional supplements to heal people and to help them come off of medications, you can't go back.
You can't go back, but the medical model and the insurance company does not support those of us or our patients wanting to get fully well.
Yeah. I
Yeah.
had to learn that the hard way, Christina. I worked
So
years
sorry.
trying to do it within the conventional medical
Right.
payer framework, and it just like sucked the soul out of me. And financially, it was devastating as well to try to provide this type of care where you spend time with people because you can't
Mhm.
just, quickly write a prescription and send them on their way. It takes time to
That's the
do.
difference, isn't it?
It
Yeah,
is.
we
Yeah.
actually get to know our clients and our patients.
Yeah. And
Yeah.
that's a privilege as well. So,
Okay, so gradually you shifted
hmm
to your current model, and what is working for you, and what are you encountering in your daily practice?
Yeah. Okay. So, to continue that journey, I did get the great good fortune and opportunity to train with Dr. Dale Bredesen in 2016. And so that kind of
Wonderful.
shifted me from general integrative functional medicine into the path of focusing on brain health and in
Hmm.
particular cognitive decline prevention. And then, since that time, I've just done more and more. And you asked about Dr. Greenblatt's, the fellowship
Hmm.
that I've recently done. And yeah, that focus was on integrative and functional psychiatry. And so in my practice now, I see, some children and adolescents, but mainly middle-aged people,
Hmm.
30s to 60s plus, with the common things.
Thank you.
Cardiometabolic issues,
Sure.
prediabetes, insulin resistance, high cholesterol, high blood pressure, overweight, obesity, and then, of course, anxiety, depression, burnout, and
Hmm.
cognitive decline, either risk factors or early symptoms. So that's
Right.
kind of my demographic that I serve.
Nice.
Yeah.
Okay.
Mhm.
Nice niche.
It is. It is. I love it. it's fun to get to be in in a place where we help people with their current symptoms, but we also get to be proactive about protecting their brain in the long run. And that's the beautiful thing about, nutrition focused medicine and functional medicine, where you're doing, root cause and lifestyle based therapies, that it helps the whole person get better.
Well, it does, but it's profoundly preventive.
That's right.
So if you start it with your children and your young people, it helps prevent them from getting into mental health and addictive challenges. Your young and sort of mid-life adults, highly preventive because we can get, that demographic taking care of themselves and eating well and doing the right exercise. That prevents the issues that come with older life. Because if we don't, then people parade through your office
Yeah.
and a little bit through mine as well with how did I get here? What happened?
Mm-hmm. Mm-hmm.
And what do I do now? And now how do I prevent things from getting even worse?
Yeah. Well, you're speaking my language. I love the preventive approach, and even, if you're beyond that time frame, when you take care of yourself and you address your own health, then that has ripple effects into
Yeah.
the lives of people that you love and that are in your
Yes.
community, and we get to, talk to our children and our grandchildren and go into the schools and try to teach this message
Mm.
that our brain is, it's like a high performance engine. And
Needs to be
unfortunately, yeah,
nurtured and taken care of and fed. But when
that's
were
right.
we, you in school, me in school, we were never ever taught that our brains ran everything and needed TLC, and that we actually knew the nutrients that the brain required to function.
Hmm.
We knew what these nutrients did. We knew what would happen if people did not get those nutrients. And we've known this information for decades, but it's never been part of medical practice or
Yes,
conversation.
you are correct. And it is very unfortunate that that's the case. I remember in medical school, truly, I remember a little section about how to create an order for TPN, total parenteral nutrition, if
Uh-huh.
someone was in the hospital and couldn't take food by mouth. That is my recollection of my nutrition
That's right.
training at a
And
very lovely
it's not
medical school.
great. It's not great nutrition in those either.
Yeah.
They're sort of at the bottom of the recommendations.
Hmm.
So this is an unfair question. I'll admit
Yeah.
it ahead of time. What's your most favorite supplement or nutrient for brain
Oh,
health?
goodness. Well, I'm thinking about my mentor who said that, when people ask him what's the most important nutrient, he
Uh-huh.
would say it's the one the patient is deficient in. And so I have
Isn't
a
that a
whole
good
list.
answer? Yeah.
He is a brilliant man. Yes. Yes. Dr. John Wilson. I had the great pleasure
Ah,
and good fortune to work with him for 3 years. And
I don't know him.
yeah, he was a leader in the environmental medicine movement, practiced
Oh, okay.
integrative medicine for 40 plus years.
Uh-huh.
Hmm. Yeah,
So you were
taught me a
very
lot.
fortunate
I
to
was.
learn from him. Right. And I love that answer.
Hmm. And, I have a list of maybe a dozen or so that I love, and they're my go-to nutrients that I take personally and also use in a lot of my patients. But do much of my supplementation comes from testing. Of
Hmm.
course, you can prescribe some things just empirically based on what the patient is dealing
Right.
with, their symptoms, but I use a lot of nutritional testing in my practice as well.
What testing do you use? What are some of the
Yeah.
labs you like?
Yeah. Well, a lot of it you can get from, standard labs like Quest and LabCorp, RBC magnesium level, B12 folate, omega-3 fatty acid
Hmm.
status, vitamin D. Um, I also am really into making sure people have stable blood sugar to fuel the brain. And so we,
Yes.
look at continuous glucose monitoring to see how their blood sugar is regulated. And, along those lines, like a hemoglobin A1C, fasting
Mhm.
glucose, um, fasting insulin levels, that sort of thing.
What about zinc and copper?
Zinc and copper are on my panel for every patient where we're, concerned about either preventing or treating cognitive decline.
Isn't that interesting? Because it's
Yeah.
also so crucial for mental health,
Mm-hmm.
for depression, for anxiety, to
Yeah.
identify if pyroluria might be floating around.
Mm-hmm.
But zinc, zinc plays a role in male health, testosterone, especially these teenage boys as well as older men, right?
Mm-hmm.
And thyroid health, which is, all of which also plays a role in mental health and emotional well-being. So
Absolutely.
many doctors have not even thought about testing for zinc or copper. And most insurance companies, they find, don't necessarily want to pay for it.
Mm-hmm. Well, number one, it's not that expensive to pay out of pocket, and it's valuable information. Yeah, Dr. Bredesen really drove that home for me with the zinc and copper because as someone's going down a neurodegenerative path like toward Alzheimer's, the zinc gets low, and it's important to try to bring that up in balance
Mm.
with copper.
I do not remember reading that in his book. I mean, I probably read it, but it didn't stick. So that's really interesting to know. I
Yeah.
didn't know that.
Hmm.
Yeah.
So I do, basic labs like that. I also do Genova Diagnostics, their Nutra eval, which has,
Mhm.
a whole host of nutrients that are tested for on that. CoQ10 level. Yeah, those we do a lot of nutritional testing.
Mhm. Nice. Very needed. What do you find comes up often with your patients in terms of nutrient deficiencies?
Hmm. I can almost guarantee if someone isn't doing fish oil supplementation, they're going to have low omega 3s, especially here in the mountains. People don't tend to eat a lot of fish. So usually people are low or at least suboptimal on
Mhm.
omega-3 fatty acid status. I often see low normal magnesium, low B12, which even if it's in the normal range, if it's under like 450, 400, you can still have neuropsychiatric symptoms with low normal
Mhm.
B12. And so we treat that. Often low ferritin, so low iron stores.
That's an interesting one, isn't it?
Yeah, it is.
What symptoms do you run across with low ferritin?
Hair loss can be one of them.
Yeah,
Uh,
really?
yeah,
Okay, I didn't
hair
know that.
loss. We try to get the ferritin up around 100, which can be challenging to do, but for people that are experiencing hair loss. But it could be fatigue. Low iron
Mhm.
can give you fatigue, or it can contribute to depression as well.
I've also heard that low ferritin levels correlate with ADHD and migraine headaches.
Yep, yep. We want to get that optimized for a whole host of reasons.
Yeah, yeah. What else?
Yeah, so I often, of course, see elevated levels of CRP,
Mhm.
C-reactive protein, denoting inflammation in the body, and that's also a huge risk factor for mental health concerns and cognitive decline, neurodegeneration. So we want to address that.
Do you also track homocysteine in that regard?
Yeah, homocysteine is, especially after working with Dr. Bredesen, that is a key marker to look at because it is significantly associated with increased risk for Alzheimer's disease if the homocysteine is elevated. So,
Mhm. What do you find that kind of cutoff is for homocysteine and dementia risk?
yeah, I think Dr. Bredesen, I'm pretty sure his ideal value is well under the green zone for the
Right.
normal labs, around 7 or so.
Hmm.
You know, it's a good goal to shoot for. But first thing you look at is the B vitamin status and any kind of genetic SNPs like MTHFR variation that can affect that.
Hmm. Hmm.
So
Do you ever use
homocysteine.
do you ever use creatine to support homocysteine levels?
I use a lot of creatine in my practice. I'm not sure I knew that there was a connection there between creatine and homocysteine.
So there's a functional medical doctor in the consultation group I run, and that is her favorite go-to for high
Interesting.
homocysteine
Oh, thank you
because it
for telling me
spares
that.
yeah, because it spares SAMe. Because
Okay.
one of SAMe's primary jobs is to make creatine. Now it has other jobs as well, sprinkling MTHFR or methyl groups sort of around the body and brain,
Mm-hmm.
but it makes creatine. And creatine, among other things, not just makes muscle, but it's also involved in mitochondrial energy production.
Mm-hmm.
So by using creatine, you can spare SAMe, which will then automatically, unless there's some blocks in the way, lower homocysteine.
Super. Thank you so much for sharing that pearl of wisdom. Yeah, I use creatine in almost every patient. I'm really
What do you
aggressive,
use it for?
um, basically for healthy aging and longevity, trying to
Mhm,
preserve muscle mass as we age, and then also for the brain health effects for cognitive function
mhm.
and mental health, muscle mass. They're all tied together.
That's right.
Yay!
We like those things. Yeah.
Mhm.
So do you have any stories that you would like to share with us?
Oh, goodness. Well, one personal story I remember
Mhm,
it's probably been about 6 years ago now, in the midst of the pandemic. And I thought, am I dealing with some depression or is this perimenopause? I was just having, a whole lot of irritability and just not feeling like my normal self. And I had
mhm.
even contemplated going on an antidepressant at the time. But of course, I did some labs on myself and my omega-3, yes, it was like 2.8, like in the
Oh,
red zone. And so I started aggressively supplementing with that. And I had a profound shift in my mental
yeah.
health. It
It,
really
it, it
just
doesn't take very
resolved.
long, does it?
You know, it didn't for me. I Dr. Greenblatt, if I'm recalling right, said that it would take at least 3 months for someone to respond, but I responded faster than that. I guess maybe to do a whole oil change for the body, it takes a little bit longer, but it really seemed to, at least in my N of one experiment on myself, it really seemed to help me. And so, it just having those personal experiences, you can
Hmm. Hmm.
learn from your patients like I do. I've had the privilege to do for a couple of decades now, but when it happens to you and you're like, wow, this really is powerful medicine.
It really is. I know, I guess it was probably 40 years ago now when my doctor first introduced me to fish oil.
Hmm.
And, I was struggling with depression and anxiety and fatigue and ADHD and, joint pain and undiagnosed celiac disease and all sorts of fun
Oh,
things.
goodness.
But when she got me on the fish oil and 3 grams of whatever. I couldn't
Hmm.
tell you now how, because I didn't know how to count grams of actual omega-3s way back when. All I
Hmm.
know is that it was 3 soft gel capsules.
Hmm.
But those 3 capsules turned my life around.
Yeah.
It was like, and for me, it only took 3 days. Three
Amazing.
days after I started
Yes.
taking it, it's like the sun came out.
I love it.
I had brighter energy, brighter mood, brighter cognition. Everything was just brighter. in 3 days.
Yeah. And it pains me that this is not a standard part of conventional medicine. When you go to the doctor and complain of symptoms of anxiety or depression or challenges, that it's not just a standard thing to run a lab panel
That's
to
right.
check some of these micronutrients and omega status.
I ended up I was just being a little snarky last night in a
Mm.
conversation with a ER doctor and nurse. And I was bored. So I decided to stir things up a little bit and talked about magnesium
Hmm.
and all the things that we can use magnesium for. And, all the things you can use magnesium for.
Yeah.
So, right. And the nurse was saying, no, you can't. No, you can't. No, you
Hmm.
can't. No, you can't. And I was saying, yeah, you can. Yeah, you really can. The research is actually there. And she
Yeah.
says, really? Mm-hmm.
Yeah.
And then they talked about using, because I've been putting together a lecture this past week where I was researching the use of high dose magnesium for pain management
Hmm.
and how they're actually using IV magnesium in place of anesthesia for major surgery
Amazing.
and to lower the amount of postoperative morphine needed. And so I shared this little tidbit just for the fun of it with the ER doctor. And he was never heard that before. And he said, well, I don't think I would trust just magnesium. And I said, read the research. I'm just telling you what the research says, which
Yeah,
was very fun.
magnesium is the miracle mineral, as we call it in integrative medicine circles. It just runs over 300 different
So,
enzymes in the body. And yeah, I use it in my clinical practice for everything from migraine headaches, muscle tension, anxiety, constipation, depression, pain, and just a whole host of conditions respond to it.
anxiety,
Anxiety for sure.
blood pressure.
Hmm. Hmm.
I think that's covered most of them. There are
Yeah.
a few outliers, I think.
Yeah.
But yeah, it's an amazing mineral. And you mentioned magnesium threonate specifically.
Yes, magnesium glycinate is my all-purpose one, for people
Mhm.
that need just gentle on the bowels because it can cause diarrhea if you take too much of it. But magnesium threonate can be especially helpful for people who have brain-based symptoms, anxiety, insomnia, attention deficit, or cognitive decline
Hmm.
because it's able to cross the blood-brain barrier more readily.
Hmm. Yeah. So amino acids, since
Yeah.
amino acids are kind of my my baby. What's your favorite amino acid?
Well, personally, in my desk drawer, I have some L-theanine. I
And
love L-theanine.
so do I.
There you go. So L-theanine helps with anxiety, and if you take it with a little bit of green tea or a little caffeine, it can help with focus.
Mhm.
I use that a whole lot in my clinical practice, in combination
Mhm.
with other things. But I would
People
say,
love it.
yeah,
Yeah.
yeah.
Yeah. I have to admit it's my most favorite amino acid.
Oh, good, good. We have a lot
Right.
in common.
We do. I mean, I used to live on tyrosine when I was first getting well,
Mhm.
and it was a lifesaver for me. And theanine
Yeah.
had not been discovered or easily available then. Um, and so I was taking 3 grams of tyrosine a day for actually a good 10 years because I needed to. Then I
Mm-hmm.
didn't. And then I got my, ADD in mostly remission. But there's still little tendrils of ADHD floating
Uh-huh.
around. And so what I use the theanine for is overwhelm.
Mm.
Like when I find myself getting tense and anxious and it feels like too much, and when am I going to get this done? Am I going to get that done in time? It's like, oh, you need theanine. And it hits the spot. Or if I'm in a meeting with my bookkeeper or my accountant,
Uh-huh.
and my anxiety goes sky high, and the information goes in one ear and it goes out the other ear, and it doesn't stop in between.
Hmm.
Right. And I first tried 100 milligrams of theanine for that, and it wasn't good enough. So now I take 200 milligrams of theanine
Yeah,
before having these conversations.
perfect.
And I can breathe, I can think, I can make decisions. The information actually comes in and lands.
Yeah.
So,
I take
yes,
mine
kind of,
before the dentist office.
there you go.
And breathing, breath work, and, the spiritual process of surrender, all of that together. But L-theanine is a really nice support.
Well, theanine really allows you to do the rest of that work.
Hmm. Yeah.
Yeah, yeah, yeah. So, anything else you'd like to share with us today?
Well, in terms of neurotransmitters, I think about just giving the body the building blocks as well. And, B6 is something you probably teach about in your course.
Oh, just a little
I'm
bit.
sure that it's critical for
Yeah.
being a building block of neurotransmitters. And yeah, so what else could we talk about? I'm sure we have a lot of commonalities. Let's see, I mentioned some micronutrients, also the macronutrients, getting
Mhm,
proper healthy fats in our diet and protein on a regular basis is so critical for brain health.
mhm.
Yes, and you wrote that
Well,
beautiful book,
it
Eat.
really is. And what a lot of people don't realize is that the research on reactive hypoglycemia for neuropsychiatric symptoms goes back to the 1960s.
Yeah, yeah.
Heavily researched in the 1960s for mood and behavioral disorders, including alcohol use disorder.
Mm-hmm. Mm-hmm. And that is also an area where I have, unfortunately, deep personal experience with reactive hypoglycemia and had to figure that one out on my own in terms of the impact that it has on my mental
Mhm.
health. And thankfully after many years of attending to it, it's at a low low
Mhm.
grade. But yeah, in protein, eating protein at a regular basis can really
That's right.
help with that and
Well, that's
managing
what I,
stress.
yeah, well, that's what I tell my chronic relapsers. 20 grams protein minimum.
Hmm.
Some people look at me and say, well, we need so much more. It's like, well, some people do need a whole lot more.
Sure.
But what I find is to turn around the lives of my people who are really struggling with addiction and with mental health issues, getting 20 grams in every 4 hours
Mhm.
is the turn point. It is the life-changing point.
Yeah, yeah, I can concur with that. We didn't touch base on vitamin D, which is not only
Oh,
a
let's
vitamin
talk
but a
about vitamin
hormone.
D.
I love vitamin D. I had to be a board certified family physician, travel to California to go to a medical conference to learn about the importance of vitamin D. You know, aside from severe vitamin D deficiency causing rickets and things that you learn in medical
Right.
school, but just how profound it is that it's a hormone and there's like 30 different types of tissue in our body that have vitamin D receptors, and
Yeah.
that when we have sufficient levels, it helps with our immune system and can be help you be resilient against autoimmunity and cancer. And it is really just overall critical for the entire body to function well.
Well, it really does. And its relationship with cholesterol, its relationship with serotonin,
Hmm.
right? And how low vitamin D can lead to depression, and very low vitamin D can even set us up for schizophrenia.
Hmm. Hmm.
and that's I think something many people don't realize.
Yeah, I've had patients in the single digits on vitamin D level, checking that on blood work, and so we go after that.
Well, what I've heard, and I don't know if you've seen this, is that those single digit vitamin D levels actually correlate with multiple sclerosis. Have
Yep.
you seen that at all?
I have seen a connection in the literature around autoimmunity, I believe MS.
Hmm.
But yeah, yeah. Breast cancer,
So, copper.
copper, yes.
Copper, and according to Dr. Walsh, postpartum psychosis, the really
Mm,
severe end of
mm.
postpartum depression,
Yeah, yes. I know copper is essential and having it be balanced with zinc is key.
right?
Um,
We want a 101.
1-to-1 ratio there is what we aim for. Of course, too much copper can be toxic for the brain. But yeah, I
Mhm.
measure zinc and copper in all my patients, and especially those after the pandemic that are, you know, chronically supplementing with zinc that can
Right.
kind of bring copper
Can
out of
bring copper
balance.
low. Yeah. And we actually do need enough copper for catecholamine support, among
Hmm.
many other things. Well, I really love talking about postpartum depression
Yeah.
because so many people don't realize that most of the time it can be very easily treated with normalizing nutrient levels that have gotten depleted by baby,
Hmm. Hmm.
normalizing omega-3 fatty acid levels that had gotten very depleted by baby,
Yeah.
right? And supporting neurotransmitters that had also gotten sideways depleted by baby with the depletion of all the cofactors.
I wish I knew you 15 years ago when I experienced that myself. I wish I, could have doctored myself knowing what I know now, or had a caring professional like yourself to
Yeah,
raise awareness. But, even just the mindset of being in the medical profession, of that toxic mindset of just stuff it all down and keep going.
stuff it all
You
down and
don't
keep
get
going, or
to,
go on medication.
right.
Well, I had been, a nutritionist, so I knew this theoretically. But, when you know something and then when you get challenged to put it into practice is a completely sometimes different story.
Hmm.
So I was taking a good amount of the omega-3s during my pregnancy. This was now 30 odd years ago. And a couple of times and borage oil, and I'm one of these people genetically who really requires the GLA
Mm.
to make PGE1. And a couple of times I ran out and I didn't really notice. And
Mhm.
I landed on the sofa feeling like I had the flu.
Mm.
And then figured out that I hadn't taken my fatty acids for several days and went and got them. And again, very quickly rebalanced and was up and functioning and fine. Well, after baby came, as such things go, I ran out and didn't notice and wasn't thinking about it. This was 30 years ago before I knew all of what I know now and have the focus that I have now. And so I ran out and I wasn't paying attention, and I ended up with postpartum depression
Mm.
by week
Mhm.
6. Um, Fairly significantly. I mean, not the far dangerous end, but enough that I was miserable. Um, and I also had tendonitis in my wrists,
Mm.
and my nipples were so tender that I called up my doctor and I said, I'm going to have to stop nursing because my nipples are not very happy.
Mhm.
And the very first question out of her mouth was, did you stop taking your fatty acids?
Smart doctor.
And it was like, how did you know? But of course, I had all the symptoms. I had inflammation,
Yeah.
I had depression, I had fatigue, but I had inflammation and depression, serious inflammation. And so again, I went back on them, and within a couple of days, So this is now 6.5 weeks after baby was born. I was fine. The depression was gone.
Fantastic.
My nipples cleared up so that I could keep nursing. Took longer for the tendinitis to go away.
Mm-hmm.
But the rest of it just cleared up immediately
Yeah.
because I'd forgotten how much DHA comes out in the breast milk because baby's brain is still developing.
Sure.
And
Pregnancy and lactation, they are definitely nutritionally vulnerable times for the mother.
they really are. And
Mm-hmm.
I don't think most people, when they get depressed, think about, oh, baby's eating up all my cofactors.
Mm-hmm.
Baby's eating up all my essential fatty acids. Am I supplementing enough?
Yeah.
Not am I supplementing at all, because most people know they should take some sort of prenatal, but is it enough?
Mm-hmm.
And then some women who have, a lot of vomiting throughout their pregnancy are not are not even retaining the food that they do eat
Yeah.
and are even at higher risk for that.
It's a good message to get out there in the world. So,
Well, I imagine you see some of that in a family practice.
mhm. Yeah, I did in my former days of doing general family practice, but
Uh-huh.
now my
And you're more
practice is
focused.
more specialized in the niche for brain health,
Hmm.
for
Hmm.
cognitive decline prevention and just health optimization and longevity now. So,
Well, so everybody wants to know, can you reverse Alzheimer's? Can you prevent it? And what do you do?
yeah, great question. So, I wholeheartedly believe that in many cases it can be prevented. There, of course, are some really serious genetic mutations where, it's hard to get around that. But for the majority of people that have a genetic vulnerability, like the ApoE4 allele, one or two copies of that, there is, and other people that don't have genetic vulnerability but have other risk factors, I think it is absolutely possible to prevent and delay onset of Alzheimer's or neurodegeneration through our lifestyle and through understanding what your risk factors are and addressing those in a comprehensive fashion. And there's very exciting research that's about to be published in a peer-reviewed literature. It's not yet peer-reviewed, but Dr. Bredesen and colleagues are getting ready to publish a randomized, double-blinded, controlled trial showing that Alzheimer's disease can be reversed through a precision medicine approach. It is just phenomenal to see this. I've been following his work since 2016 and addressing all the subtypes of risk factors for cognitive decline in my practice. But we finally have gotten to the stage where they're able to do a randomized controlled trial, and the world is about to see that and have to grapple with it. And hopefully, that will shift how we care for people with neurodegeneration. And even better, we need to start being proactive about it, even in our
Yeah,
children, as you
proactive.
mentioned, children and teenagers and adolescents, of teaching them how to take care of their bodies and their brains
Yeah.
and in midlife, it's just this precious window of opportunity to really care for the brain because most people that have Alzheimer's disease, they started the disease process 10, 20, 30 years before they had any symptoms at all. And so,
Hmm.
you could be a healthy 40-year-old healthy and have Alzheimer's disease, but not know it. And we're having advances in diagnosis and early detection, but the key really is prevention. It is so much easier to prevent
Hmm.
something than it is to reverse it. And of course, not all cases can be reversed. The person, the individual, has to have some degree of awareness of the disease process and still have that inner drive and buy-in to a process of making lifestyle change because
Mhm.
it's a hard thing to do.
It
It's a
is. You have to
hard
be
thing.
motivated and
Hmm.
you need support. People need
Exactly.
support.
Exactly.
Well, this has been a lovely conversation. Thank you so much.
You're welcome, Christina. It has been really, really fun. I love what you're doing and I might put your course on my future wish list for additional trainings and certifications. I love what you're teaching and the work that you're doing in the world.
Well, thank you so much. And likewise. So, if people want to reach you, how can they do so?
Yeah, I have a website, caringforthebody.org is our practice website. You can learn all about our different services. And I also have a YouTube channel. Rethink Aging with Dr. Libert is my YouTube channel where I,
Nice.
share information about helping people who are in midlife or beyond be proactive about their brain health.
What a wonderful resource. I'm going to have to look that up.
Thank you. Yes.
Well, everyone, thank you so much for joining us in this wonderful conversation in this episode. If you enjoyed it, please, of course, push the like button and the subscribe button and share it with all your friends and colleagues and family members who you think would benefit from this amazing information. See you next time. And thank you so much for being with us. Thank you for tuning in to Power Up Recovery with Nutrition. I'm Christina Veselak, your host, and I hope today's episode has inspired and equipped you with new insights and tools to support your recovery journey or practice. If you enjoyed this episode, please subscribe, leave a review, and share it with others who could benefit from the knowledge shared here. Stay connected with us for more episodes filled with practical advice, expert wisdom, and inspiring recovery stories. Remember, nutrition is a powerful tool in mental health and relapse prevention. Power up your recovery today. I'm Christina Veselak, and I'll see you next time.